Hello, my name is Poma, and today I'll be performing Foley Catheter insertion in a female. I have my garbage bag right here. I have my hand sanitizer, my gloves, my Foley Cath kit, and then I have my towelettes right here, okay? So I'm going to stand on my dominant side. I'm going to go ahead and do hand hygiene. I'm going to put this right here so I can use it again. Knock on the patient's door, introduce myself, and close the curtain for privacy. Knock, knock, knock. Hello, Miss Poma. My name is Kitnoy, and I'll be your nurse today. I'm going to go ahead and close the curtain for privacy. All right. Today, I'll be inserting a Foley catheter inside your urethra. We just want to make sure that if you're retaining anything, all of that drains out. And you're on some strict I's and O's right now, so we just want to make sure you're all right. Does that sound okay? All right. So can you go ahead and confirm your full name and date of birth while I look at your wristband? All right. So to do this procedure, I'm going to go ahead and clean the outer side of your vagina, and then we'll go from there, and then I'll walk you step by step about what we're going to do, okay? Does that sound good? All right. So I'm going to go ahead and hand sanitize. I'm going to get my gloves on. And I'm going to go ahead and have you spread your legs. Yep, spread your legs. And then you're going to bend your knees. Yep, go ahead and bend your knees. And then you're going to point your knees outwards, okay? So that way I can fully see your meatus, your labia, and see that urethra right there, okay? Thank you. So we're going to go ahead and get non-rinse soap first. Non-rinse soap and water, and we're going to clean your outer side, okay? Your meatus. I'm going to go ahead and just hold here. That way I'm making sure that we're not getting anything anywhere, so I can fully see this and clean, okay? And we're just going to wipe downwards. So I'm going to go ahead and get started. So I'm going to wipe downwards. There you go. And I'm going to fold. This is the non-rinse soap and water. So down and fold. Then I'm going to toss. And now I'm just going to get the dry towel, and I'm going to do the same. So I'm going to go ahead, fold, and dry towel down, fold to make sure I'm not getting it on that same side, and dry down and toss. All right, I don't see no redness, I don't see no lesions, and no, is there any tenderness on there? No? Okay. Are you feeling any discomfort at all, Miss Poma? No? All right. So I'm going to go ahead and toss out my dirty gloves. Hand sanitize. I'm going to open up our sterile kit. So Miss Poma, during this procedure, I want to make sure that we are not cross-contaminating. So please be sure you try not to move at all. If you feel any pain or discomfort, please let me know, okay? So I'm going to put this bag on the side for backup if I need to throw out more stuff, okay? I already have a trash can right there, but just in case. Hand sanitize. And I'm going to go ahead and open this up. Sides and the sides. I'm going to make sure I have room. And then I'm going to go ahead and get this. Okay, Miss Poma, I'm going to go ahead and drape this underneath your bottom. So you're going to have to lift up your bottom. Okay, and I'll slide this under, and I will try not to touch you at all because I do not want to break sterility, okay? So go ahead and lift up your bottom, and I'm going to put the shiny side down on the count of 3, okay? 1, 2, and 3. There you go. Does that feel okay? Great. So I'm going to go ahead and continue to open this. And pull towards me. And I want to make sure that I am only touching the outer edges. And if they do overlap, making sure it's just on the 2 centimeter border, okay? There you go. Move it up there just a little bit more. There you go. All right, how are you feeling? Good? Okay. So now I'm gonna go ahead and get this my gloves on. So I'm gonna go ahead and put it on here. Open it. There you go. Then before I start, I just want to make sure I'm not doing any wrong sterility. So I'm going to go ahead and pinch here, right there, and I'm going to slide my hand in, hold down. There you go. It's on. I'm going to go ahead and go where the cuff is, and then slide my hand in. There you go. Got my sterile gloves on. I'm going to go ahead and toss this away now because I do not need this. And that's tossed in the trash. All right. So Ms. Palma, I'm going to go ahead and drape you. Like I said, please try not to move as I do this, okay? Then I'm just going to drape like that over, and I'm making sure I'm not touching the patient still. I had to rip this because I needed to remove it after, but we're gonna leave it like this, okay? And I'm gonna get my kit out, and I can move this still. I'm gonna open up my alcohol swabs, toss that. The top part, I'm gonna go ahead and get my lubricant, open it, and I'm gonna put some on the side right here so I can use it. And then I'm gonna toss this out because I don't need it anymore. Gonna look at my syringe. All right, I'm gonna take out this top part and toss it. And I'm gonna go ahead and attach it to my Foley, this green part right here. And just wanna note that I made sure like the bed was up to my position so I'm not bending over, hurting myself, the patient's comfortable, and then I'm gonna continue to go on, okay? All right, so next we're gonna go ahead and clean your urethra, okay? So now I'm ready to touch the patient. I have the swabs right here. I'm gonna go ahead and get a swab, and I'm gonna clean the furthest part from me, and the part next to me, and then the middle, okay? So I'm gonna move this down a little bit so I can see. All right, so I'm gonna go ahead and pull the labia apart like that. And then I'm gonna clean the outside right here, toss. I'm gonna clean, holding it back again, right here, and then toss. And making sure I'm not going over the sterile field with the dirty swabs. And clean down the middle, and toss. Ms. Palma, how are you feeling? All right, so I'm gonna go ahead and insert the silicone tube. There's already some Vaseline, so that I'll be putting on there. So it should just slide in, okay? You ready? So I'm gonna hold it right about here, which is like 5 to 7.5 centimeters, so 2 to 3 inches, okay? You ready? All right, so go ahead and take a deep breath for me. And I'm going to go ahead and insert it into the urethra, okay? So I'm going to go ahead and slide it in. So I'm sliding in. That's about 2 to 3 inches. I feel some resistance. Okay, Ms. Palma, I'm going to go ahead and slide it in some more. 2 to 3. There you go. All right. So now I'm going to switch my hand so I can hold on to this while I inflate the tube, okay? And I made sure I did not touch my non-dominant hand. All right, so I'm gonna go ahead and hold that. And I'm gonna go ahead and inflate, all right? So I feel some resistance. So I'm gonna go ahead and push in. Okay, so I'm holding it tightly because I wanna make sure that it's stable. Put all the fluid in there. All right. Nice. So now that it's in there, I want to make sure I pull it back a little bit to where there's some resistance. That's how I know the balloon is in there, okay? All right, so now I'm going to toss this. All right, Miss Palma, how are you feeling? Okay, I'm going to go ahead and put this bag on the side of the bed, okay? Whenever you need to go to the bathroom or if you need to get up, please let me know and we'll have somebody assist you. If you feel any pain or tenderness, please let me know, okay? All right. So I'm going to let go of that. How are you feeling? Good? Okay, so I'm just going to toss everything. And I made sure that there's no redness, pain, or tenderness over here. If I wasn't able to see it before, I was able to see it now. I'm going to remove all of our stuff, garbage. I'm going to take this off, garbage, take this off, and garbage. Then I'm going to go ahead and take off my gloves. Okay, Miss Poma, I'm going to go ahead and put your gown back on you. Just let me do some hand sanitizer real quick. Put your gown back on you. I'm going to place the call light next to you. Miss Poma, do you have any questions, comments, or concerns before I leave? All right. So if you don't have any questions, I'm going to go outside and document my procedure and note any findings that we had, okay? All right. Thank you. I'll see you later.